Hi, everyone. My name is Dr. Dean Olson. I'm an aviation medical examiner. I'm starting a series of presentations on FAA medical certification related topics. My goal is to answer questions and clear up confusion that some in the pilot community may have regarding medical certification issues. I want to talk today about the FAA medical certification process from the 30,000-foot view, just a general overview with my added perspective. I put this presentation together because I go over this information frequently in my office when I'm seeing pilots. So if you're new to this process or if you have questions about the process, my goal is to help you understand what this is all about and why we're doing this. So hopefully you'll find this beneficial. So first, a disclaimer, I am an FAA designated HIMSS AME, meaning I perform long-term monitoring of pilots with drug and alcohol addiction, as well as pilots who have a history of depression and or anxiety and who are taking approved psychotropic medications. I'm a senior AME, meaning I can perform physicals on first-class pilots, and I'm also an FAA employee AME, meaning I perform physicals on air traffic controllers for the FAA. But most importantly, I'm not speaking for the FAA during this presentation. The information I'm presenting is based on my opinion and my experiences working with pilots for their medical certification over the past 10 plus years. And finally, the FAA medical certification process and requirements can change over time and may result in changes to this information, in particular the risk stratification model that I present later on in this video. So please note that the date of this presentation is January 17th, 2024. So some items to consider. These are the topics that I want to present. First and foremost, I want to talk about the history of flight surgeons and medical certification, very brief. The next topic is I want to talk about FAA terminology that all pilots should know or at least be aware of. Then I want to talk about planes and pilots and the safety of the airspace. Uh, After that, I want to talk about the biggest concern that the FAA has regarding pilots and medical certification. Then the implication of disqualifying medical conditions and what will be involved with getting your medical. After that, the risk stratification of disqualifying medical conditions. And then finally, putting this into perspective and what do some of the numbers show. So let's look briefly at the history of flight surgeons and medical exams. In World War I, pilots who crashed sometimes needed medical attention and occasionally needed surgery. It made sense then that surgeons would be involved, and hence flight surgeons were born. The surgeons during this time, they kept data on fatal accidents during the war, and what they found was surprising. And you can see the numbers here. And the most striking is that 90% of all fatalities were pilot related. 60% of those were due to medical conditions. So this means that overall, 54% of all fatal accidents were due to medical conditions. So this was the beginning of needing to screen pilot candidates for medical conditions before they would go and fly. Back then, physicians based the screening on their best ideas, not necessarily on medical evidence. And an example of this part of the exam is what I list here, pistols and needles. And this was used to screen for nervousness. So what a flight surgeon would do is they would have a candidate hold the needle between their thumb and their forefinger, and somebody would approach them from behind with a pistol, and they would fire off that pistol. And if that candidate flinched enough to draw blood, they were considered too nervous to become a pilot. Thankfully, we don't do that today. Currently, the FAA relies on medical evidence to make certification decisions. And so this boils down to input from your clinical care providers, any notes that they may have, tests that are performed, and evaluations. So there's a list of different things that the FAA can gather in order to make their decision. So some FAA terminology. The first of this is application. An application consists of two parts. First is MedExpress, and this is information that the pilot enters into the system. And after that, they go see their AME, and a flight physical is performed, and the AME enters the flight physical information into the second half of the application. Um, current Current means within the prior 90 days. So it's often that a pilot will receive a letter from the FAA requesting additional information. This may be requesting tests, provider reports, or visit notes, just some of the things that I mentioned on the previous slide. And when the FAA sends out a request for information, they usually use the term current, and that means within 90 days. So um, keep that in mind if you receive a letter from the FAA with the term current in it. A disqualifying condition. So the Code of Federal Regulation, Part 14 CFR Part 67, defines the parameters of the physical exam. A disqualifying condition falls outside of the passing parameters and results in not passing the physical exam yet. The FAA will want additional information regarding the disqualifying condition, and I'm going to talk a little bit more about that. Next term is deferred. When a pilot has a disqualifying condition, or if for some reason they aren't able to pass the physical exam, the AME is not allowed to issue a certificate, and the AME will defer your exam for the FAA to make a decision. Usually this will result in the FAA requesting additional information. Finally is legal enforcement action. This is probably the scariest term that shows up on a letter that a pilot receives from the FAA. So if you receive a letter from the FAA requesting additional information and fail to provide the requested information, the FAA can deny your application or revoke your medical certificate if one was issued by the AME. So legal enforcement action really refers to a denial of your application or a revocation of your medical certificate. You can always get that back or get your medical certificate back. If they deny your application, you can always send in a new application, meaning you do a new physical exam and new Med Express information. And if they revoke your certificate, if you submit the information that they're requesting, you can get your medical certificate back. If you submit an application and have a disqualifying medical condition, as I mentioned, you'll get a letter from the FAA requesting additional information. So what this slide shows is several paragraphs taken from an actual letter sent to a pilot. And you can see the letter first talks about the pilot's application, then goes on to refer to the Code of Federal Regulations, and then gives a 60-day deadline from the date of the letter for supplying the requested information. The last paragraph is where it refers to legal enforcement action if the information is not provided within the designated amount of time. So just an example of an actual letter for you to view. Next, talking about planes and pilots and the safety of the airspace. So you have to realize that planes are defined by and function through physics and engineering. It's very precise. Because of that, they're predictable, mostly, and we can generally rely on precise performance. Now, pilots, on the other hand, come in all shapes and sizes, and their function is dictated by genetics, biology, and the environment around them. And because of this, they're less defined, less predictable when considering the effects of a medical condition on any single pilot's status and functioning with regard to the flight environment. We have to rely on statistics to determine acceptable ranges for medical conditions. So the biggest concern for the FAA is impairment or incapacitation. When a pilot is flying an aircraft. So the poster child of this is cardiovascular disease. Having a heart attack when flying, okay? Historically, this has been the most prominent condition the FAA has worried about, but other conditions may put the airspace at even more risk. I've listed some of these that are more common on this slide, but it is not an all-inclusive list by any means. The point that you should take away from this is that many conditions involve risk to the airspace with the concern for impairment or incapacitation. Disqualifying medical conditions. These fall outside of the parameters of the flight physical. Now, this doesn't mean that you're finished and not going to get your medical certificate. It just means that you didn't pass the physical at that moment in time and that the FAA will want more information to determine the stability of your condition to assess the risk to the airspace. For all conditions, the FAA wants to know three basic things. Number one, what is the condition and is it stable? Number two, is the pilot taking any medicines, and if so, what are they, and are they experiencing any negative side effects? And number three, does the treating provider recommend any treatment changes? Now, some conditions pose a greater risk than others to the airspace. So depending on the condition, the FAA will require more information above and beyond these three basic items to make their determination of medical certification. So I've put together this illustration of a risk stratification model for educational purposes. Again, this is not the FAA putting this together. This is my construction for helping pilots understand this whole process. What you can see on the slide is that there's the flight physical parameters per the CFRs. If a pilot has a disqualifying medical condition, the way that we can look at it is this risk stratification model in the yellow rectangle. And this is all in regard to the potential for impairment or incapacitation. So you can see I've constructed level 1 to level 5, level 1 being the least risky and level 5 being the most risky. Again, I want to stress that this is a model for descriptive purposes only. I base the risk levels on what the FAA requires from pilots in order to get their medical certificate, as well as what they need to do to maintain their medical certificate. Now, this generally means you're going to fall under special issuance. On level 1, it's KHAKI criteria, but in general, the rest of these are going to fall under special issuance. If you have a disqualifying medical condition, your medical certificate, when it falls under special issuance designation, that letter will define and outline the additional requirements the pilot needs to follow in order to maintain their certificate. You have to remember that the FAA is a data and document-driven organization, and they don't know you except for what's on that piece of paper. So their method is to gather the information they feel necessary to determine the stability of your condition in order to ensure the least amount of risk to the safety of the airspace. So looking at this risk stratification again, the higher you are on the risk level, the more information the FAA will want you to provide in order to determine the stability of your condition, and the more frequently they will want you to provide that information in order to maintain your medical certificate. So in my assessment, dependence on drugs and or alcohol is the most risky situation for the safety of the airspace. Level 1 are KHAKI conditions. KHAKI stands for conditions AMEs can issue. Basically, there will be information that's required that you supply from your treating provider about your condition, and the AME reviews it, and if they determine the information shows your condition is stable and there are no other concerns, then the AME will be able to issue a certificate provided you pass the remaining portion of the physical exam. If you look at level 2 and above, the FAA will be involved with direct review of your medical information, and this is where we start to get into the special issuance considerations. So putting this all into perspective, the FAA's goal is to maintain the safety of the national airspace. For pilots with disqualifying medical conditions, they will provide a pathway for medical certification for the vast majority of conditions. But there are some conditions that will most likely not get a medical certificate. And some of these examples are uh, bipolar disorder, personality disorders, a heart transplant, or someone who's having hallucinations. Not conducive for safety in the flight environment. But looking at the numbers, in 2018, there were over 380,000 medical applications submitted to the FAA. And when all was said and done, all applications were reviewed and all medical certification decisions were made. Only about 400 applicants were fully denied. So the bottom line is the vast majority of pilots will get a medical certificate. You just have to be willing to go down the pathway that the FAA presents for medical certification. So that's the presentation. Thanks for taking the time to watch this video. I hope it was helpful. I'll be posting additional videos in the future, so feel free to check back every so often for new videos. If you would like to, please subscribe. And if you would like to suggest any additional topics that I speak about, please submit them to my email address. Have a great day, and let's hope for blue skies ahead.